Welcome. My name is Dr. Forrester Dean. I am a chiropractor, a physiotherapist, a primary care physician. I have a sports and family practice in Manhattan Beach, California. I also teach tennis and yoga rehab. I specialize in chronic pain, low back pain, surgical failure pain, hip pain, any joint pain, muscle pain. I treat without medication. I treat without surgery. And I treat without using any needles or injections. I want to introduce a new concept that I have. I recently launched a new website and service. It's called betterpatientsolutions.org. It's a website it's almost done. This is it here. And basically what I have founded with Better Patient Solutions is a patient advocate website. So you go as the patient, you come to the website and you can find self-help forms, tools, services to help you as a patient become empowered by providing medical self-help tools and support through the website. This will help you improve the quality of your care, build a better relationship with your doctor and any other services that you're getting medically, even if it's with another chiropractor, the doctor that you're using currently, a doctor that you like, or maybe a new doctor that you haven't met yet. One of the most important things that we can do for you, the patient, is to help you have a voice and choice regarding your care. So that's an overview of what the website is about. You go to the website, you can read stories of other patients, how they've had problems. Maybe some of those stories sound familiar to you. You can resonate with those stories, and you can find by category, whether it's let's say your first appointment with a new doctor, or a referral, or getting an MRI or an X-ray or a lab or other imaging or other supporting tests or exams that would help the doctor with your care. Also, advice about going to physical therapy or other conservative care choices. The main thing with the website is to help you honestly really build a better relationship with your personal values, what you want to get out of your care, and what kind of relationship you want to have with your doctor. We all know that the healthcare system today, it's broken. I listen to a lot of podcasts. I've talked to other doctors. I've talked to other patients. And basically what we have is a triangle. So we have the doctor, the physician here, we have the patient over here, and the third piece of the triangle is the healthcare system. And honestly, we all agree that professionally, that the healthcare system is probably never going to budge more than where it is. Nobody can really find a good solution, an easy solution that isn't going to be painful financially or quality of service, or something that's going to help doctors actually feel better about their own jobs. Right now, doctor burnout is like 60%. And most patients don't know that, but doctors are really overworked. They're being underpaid. They wish they could give better care. Sometimes the insurance company or the system itself ties their hands on what they can provide for service or care. So I looked at that same triangle and I thought, well, we're never going to be able to change all the doctors or get them on board. Doctors all over the world, really, because this is a worldwide problem. And we're never going to be able to get the insurance company or the system itself, the payers or the people who are monitoring what services you get, they're never going to budge either, because healthcare is for profit. And they want to make their money. So less service and less time doing the service becomes a goal. Less costs become a goal for them, but your costs go up because that helps them with their profits. And by and large, the ones that really care are the doctors and not the people in the system. It's just administration. So I thought, well, there's one part of the triangle that hasn't really been addressed that much because it's a big task. And I thought, well, let's empower the patient. Let's help the patient learn how to bypass some of the struggles if they understood how the system worked better. So on my website, what I do is I go step by step through the patient process. Your first appointment, a follow-up, maybe getting x-rays or MRIs, the treatment plans that are offered to you, your personal values, what kind of care you receive, is the quality of the care, how long is it going to take, what is it going to cost, right? All these things that go into the lineage of your care. So what I want to do is I want to shrink the cost and shrink the time so you feel better a lot faster. And you do this by understanding basically how doctors operate on their side of your care. And when you know that, you have what's known as a pearl. You have something special that you can put in your pocket that's going to help you understand what's going on. And it's like, a pearl is like an advantage. So we say in the medical business, doctors talk about finding treatment pearls. They're like little hidden gems somewhere in the knowledge set or in research, and they find these little pearls and they take them out and they put them in their pocket, and then they have like this a new way of looking at things, or they've got just some sort of advantage. So I'm saying, let's take that pearl and let's share the pearl with you, right? So you can put the pearl in your pocket. So now you have an understanding about how the other side works, the system works and the doctor works. So one pearl that you could have in your pocket is how to help the doctor speed your appointment along quicker so that they're more on time, help them get to your diagnosis quicker, help them get your treatment plan happening faster, and of course, most importantly, having you out of pain or resolving your condition quicker. But all of that is wrapped by your values, being able to talk about your values to the doctor. Look, I don't want needles. I don't want to have somebody talk to me about surgery possibilities. What I want to know is what's the least invasive. So this is what I would say, and this is what you're going to find on the website. I want something least invasive that's at low cost. It's easy for me to do. It's something I can do every day at home once we've identified what the problem is, and let me help the doctor. So instead of going to the doctor and saying, "Doctor, fix me," you say, "Doctor, I'm willing to do a lot of work on my side with my lifestyle and my diet and whatever." That's all on the website, that conversation that you can have. And then, the doctor's like, "Wow, well, then we can move things along quicker," right? So the struggles that the patient have today, we know, are the type of care doesn't meet your values, or maybe you haven't even thought about your values. Improving the treatment, the time, the quality of the treatment. Is this treatment, for example, epidurals, right? Patient satisfaction at 12 months with epidurals less than 1%. So why are thousands and thousands of epidurals prescribed every year when they don't work? Well, because insurance pays for it. And this is what I call kicking the can of your treatment. So is it going to make you better? No. Does it give you a little hope? Maybe, right? But why not just jump to the thing that works the best, right? So this is the kind of conversation you learn to have using the tools on the website. Also reducing your out-of-pocket costs. So the doctor says, "Oh, I want an MRI. I want to prescribe an MRI." They don't say, "Oh, by the way, do you have $50 or $300? Or I even have a patient that had a $2,200 out-of-pocket cost for an MRI when I can prescribe the same MRI for $420, and her doctor charged $2,200 and she had to pay that out of pocket." Well, that's not good. So on the website, you learn how to talk to your doctor about those costs. Also reducing the total number of visits. So instead of going, visit, come back, oh, from the referral, oh, then your lab results, oh, and then this, and you're like, that's like that same kicking the can. I diagnose my patients on the first visit and we get start the treatment plan on the first visit, and I don't need to order usually any extra stuff. So it makes the patient very happy. And then also, I, of course, want you to feel better as quickly as possible. And then I feel like I'm building a better relationship with the patient because I'm meeting their values, their expectations. I always say when they come in, so thank you for coming in, and so how can I help you today? What are your expectations of me? And they say, what do you mean? And I say, well, give me my marching orders. You're here with a problem. Tell me what you want, because that's my job. I don't just do what I feel like I want to do. I'm going to say, okay, well, you say you have pain. And then I'm going to say, oh, well, I need to send you for a surgical consult. I need to send you to a rheumatologist. We need to get an x-ray, or maybe we need to get an MRI, or we need to get a nerve conduction test. And next thing you know, it's been 2 months, the patient doesn't feel any better. That, to me, that's the same thing as, let's say I go to the grocery store and there's a pineapple. Well, that's nice. I don't know what to do with a pineapple, so I don't buy a pineapple, right? So I'm just pushing my cart along the store, and other people are putting things in my cart for me. They're like, oh, this is delicious. You should try this. Like, yeah, but that's Cheetos. It doesn't meet my values. I would rather have, like a really nice fresh cheese, or maybe a cottage cheese or something that's healthier that meets my values. Well, that's the same thing, that grocery store example, the same thing as when you go to the doctor and they're giving you healthcare treatment plan ideas with no choices, just like, here it is, you're going to get an epidural, but it doesn't meet your values. So you need to tell them what meets your values. And then now you're getting better sooner, and you're feeling a lot better about your care, and you're building that really great relationship with the doctor because he knows what you're all about. So this is an example, just quickly, this is an example of a worksheet that you would find on the website. So it's available as a download. So you find the topic on the list, and this one is Let's Get Started, Good Advice from Better Patient Solutions. So you put your name here, and then this box here is just a basic description of what this worksheet's about. And then on this worksheet, basically, you're just trying to get a little more honest with yourself about your values. Now you can fill this out and take it to the doctor with you, and you can read this. Say, hey doctor, I'm just going to tell you about my values. It's going to take about 15-20 seconds. I'm just going to read really quickly from here, right? Or you could give this to the doctor, and then you could highlight some things that matter the most. And now they really know a lot more about you, not your complaint, but they know more about you. So that helps them get closer to the treatment ideas and what you're all about, right? Not necessarily about your health, but about your preferences, your lifestyles, your goals, your struggles. Like, what do I struggle with my care, or with my own health, right? All those kind of things. So anyway, thank you for coming. This is just the intro. There will be one video, one YouTube for each of the downloads, and right now there are 15, and there could be more. But what I'd really like for you to do is go to the website, and you can scroll through, and you can go to subscribe, which is right here at the bottom of the first page. And what I want you to do is subscribe. I'm going to send you some of my little pearls and some of my information that I think could really help you in the beginning. And then at the back of the web page at contact, you can send me your story. Email me your story about your struggles with your care. I can't give you medical advice on the website, but I want to know, like, should I develop more downloads? Should I be providing different kinds of advice, other kinds of advice that would be really helpful to you all out there? So remember, I'm doing this from the doctor side, but then there's the more important side, which is the patient side. So again, thank you for coming. My name is Dr. Forrester Dean, and my goal is for you to have better patient solutions. Thank you. See you next time.